Every year, thousands of older adults are told they may be developing memory loss or even dementia. It's a frightening conversation, and for many families, the first thought is always the same. I guess it's just part of getting older. But after spending many years caring for older patients, I've learned that this isn't always the whole story. More times than you might expect, the real problem isn't age alone. Sometimes, it's something much closer to home. In fact, it may already be sitting in your medicine cabinet. A medication you've trusted for years, one you've taken exactly as directed, one you never imagined could affect the way your brain works. I've met patients who were convinced they were losing their memory forever. I've spoken with worried husbands, wives, and adult children who believed dementia had already begun. Yet, in some of those cases, the cause wasn't immediately obvious because no one had considered looking at the medications they were taking every day. That's why I wanted to make this video. Today, we're going to walk through 9 common types of medications that have been linked to memory problems or changes in thinking, especially in older adults. My goal isn't to scare you, and it's certainly not to tell you to stop taking any medication on your own. Instead, I want to help you understand what questions to ask and what conversations are worth having with your healthcare provider. As we count down the list, I want you to pay especially close attention to number 3. It's prescribed to millions of people every year, and most patients never suspect it could have any connection to memory changes. In my experience, it's often one of the biggest surprises. Before we begin, I'd like to hear from you. Tell me your age in the comments, and if you're comfortable sharing, let me know how many prescription medications you take each day. It helps me understand who's watching, and your experience may help someone else as well. Now, let's start with number 9. Number 9 is Benadryl, also known by its generic name, Diphenhydramine. Most people don't think twice about this medication. It's been around for decades. You can buy it without a prescription, and many people keep a bottle at home for allergies, colds, or even to help them sleep. Because it's so common, it's easy to assume it's completely harmless. But for older adults, there is an important detail that often gets overlooked. Benadryl works by blocking a brain chemical called acetylcholine. This chemical plays an important role in memory, learning, and clear thinking. As we get older, our brains naturally produce less acetylcholine than they did when we were younger. That means medications that reduce it even further may have a much bigger effect in older adults than most people realize. I remember one patient in his early 70s who had been taking Benadryl almost every night to help him sleep. Over time, he noticed that he was forgetting appointments, misplacing everyday items, and struggling to remember simple conversations. At first, both he and his family assumed it was simply part of getting older. It wasn't until we carefully reviewed his medications that Benadryl stood out as a possible contributor. His experience isn't unique. Research has found that long-term use of medications with strong anticholinergic effects, including diphenhydramine, has been associated with a higher risk of cognitive decline. That doesn't mean everyone who takes Benadryl will develop memory problems, but it does mean this medication deserves a closer look, especially if it's being used regularly. Here's something else many people don't realize. Diphenhydramine isn't found only in Benadryl. It's also an ingredient in some nighttime cold medicines, sleep aids, and allergy products. You may be taking more of it than you think without ever noticing. If you use any of these medications on a regular basis, take a few minutes to read the label and check the active ingredients. Then talk with your doctor or pharmacist about whether there may be a safer option that fits your needs. Never stop a medication on your own, but don't assume that over-the-counter always means risk-free. Now, let's move on to number 8. Number 8 is a group of medications called proton pump inhibitors, often known as PPIs. Millions of people take these medications every day for acid reflux, heartburn, or stomach ulcers. Drugs like these can be very effective, and for many patients, they provide real relief. The problem is that some people stay on them for years without ever thinking about how long they've been taking them or whether they still need them. When we talk about these medications, most people think only about the stomach. Very few ever think about the brain. One concern that doesn't get discussed often enough is that long-term use of PPIs may reduce your body's ability to absorb vitamin B12, along with other nutrients that play an important role in healthy nerve function. Over time, low levels of these nutrients may affect the way the nervous system works. The tricky part is that the symptoms can develop slowly. Someone may notice more forgetfulness, difficulty concentrating, or feeling mentally slower than usual. Because these changes happen gradually, it's easy to assume they're simply part of getting older rather than considering whether a long-term medication could be playing a role. Researchers have explored this possible connection for years, and several studies have suggested an association between prolonged PPI use and a higher risk of cognitive decline. While the research continues to evolve, these findings remind us that even medications we use every day deserve periodic review. That doesn't mean PPIs are unsafe or that everyone should stop taking them. In many cases, they are exactly the right treatment. The goal is not to avoid these medications. The goal is to make sure they're being used for the right reason, at the right dose, and for the right length of time. If you've been taking a PPI for months or even years, it's worth asking your doctor whether it's still necessary or whether your treatment plan should be reviewed. Sometimes continuing the medication is the best choice. Other times, there may be another approach that works just as well. The important thing is to make that decision together, with your healthcare provider, not on your own. Now, let's continue with number 7. Number 7 is Oxybutynin, a medication commonly prescribed for overactive bladder. This is a condition many older adults live with, but very few like to talk about. Frequent trips to the bathroom, sudden urges to urinate, or waking up several times during the night can have a real impact on daily life. For many people, Oxybutynin provides welcome relief and helps them regain confidence and independence. There's no question that this medication can improve quality of life. But there's another side to the story that deserves attention. Like Benadryl, Oxybutynin has strong anticholinergic effects. That means it can block acetylcholine, a brain chemical that plays an important role in memory, learning, and clear thinking. As we get older, our brains become more sensitive to medications that interfere with this system. What may seem like a small effect at first can become more noticeable over time. Several studies have found that long-term use of medications with strong anticholinergic properties, including Oxybutynin, may be associated with a higher risk of cognitive decline in older adults. That doesn't mean everyone who takes this medication will experience memory problems. It does mean that both patients and healthcare providers should be aware of the potential risk, especially when the medication is used for an extended period. One of the challenges is that changes in memory often happen gradually. Someone may become a little more forgetful, lose track of conversations, or have trouble remembering appointments. These changes can be subtle enough that families simply assume they're part of normal aging. As a result, the possible role of medication may never be considered. The good news is that treatment options have changed over the years. Today, there are other approaches and medications that may have less impact on the brain for some patients. The right choice depends on your individual health and symptoms, which is why this conversation should always happen with your doctor. If you're taking Oxybutynin and you've noticed changes in memory or thinking, don't stop the medication on your own. Instead, ask whether another treatment might be a better fit for you. Now, let's move on to number 6. Number 6 may surprise you because it's one of the most commonly prescribed types of medication in the world: statins. These medications are used every day to help lower cholesterol and reduce the risk of heart attacks and strokes. For millions of people, statins are an important part of staying healthy. They've helped save countless lives, and for many patients, the benefits are clear. But like many medications, there's another side of the conversation that's worth understanding. Most people think of cholesterol as something that's only harmful. The reality is a little more complicated. Your body needs cholesterol for many normal functions, including supporting healthy nerve cells. The brain actually contains a large amount of the body's cholesterol because it's an essential part of how brain cells are built and communicate with one another. This is one reason researchers have looked closely at whether certain statins might affect memory in some people. Some statins are more likely than others to reach the brain, and a small number of patients have reported problems such as forgetfulness, difficulty concentrating, or feeling mentally less sharp after starting treatment. Several studies have explored this possible connection. The results have been mixed, but they suggest that memory changes may occur in some individuals, even though many others take statins without experiencing any cognitive problems at all. That's an important point to remember. Not all statins are the same, and not everyone responds to them in the same way. A medication that works well for one person may not have exactly the same effect on someone else. If you've started a statin and later notice changes in your memory or thinking, don't ignore those symptoms. At the same time, don't stop taking your medication on your own. Suddenly stopping a statin could increase your risk of serious cardiovascular problems. Instead, bring those concerns to your doctor. Together, you can review your symptoms, discuss whether the medication could be playing a role, and decide if any changes are appropriate. Sometimes the best solution is simply adjusting the treatment plan rather than stopping therapy altogether. Now that we've reached the halfway point, the next medications on this list become even more important, so let's keep going. We've only reached the halfway point, and we've already covered several medications that many people take every day without giving them a second thought. If you're finding this information helpful, take a moment to click the like button and let me know in the comments how many prescription medications you take each day. Now, let's continue with the medications that deserve even closer attention. Number 5 is a group of medications called Benzodiazepines. These medications are commonly prescribed for anxiety, panic attacks, and insomnia. For many people, they work exactly as intended. They help you relax, fall asleep more easily, and provide short-term relief during stressful periods. When used appropriately, they can be very helpful. The concern begins when they are used for long periods of time. Benzodiazepines work by slowing activity in the central nervous system. That calming effect is what helps reduce anxiety and promote sleep. But when the brain is exposed to that effect day after day, month after month, it may also begin to affect attention, memory, and the ability to process information clearly. Researchers have studied this question for many years. Several studies have found that long-term use of benzodiazepines may be associated with a higher risk of cognitive decline, particularly in older adults. While not everyone will experience these problems, the possibility becomes more important as we age because the brain becomes more sensitive to medications that affect the nervous system. Many patients don't describe their symptoms as memory loss at first. Instead, they often tell me they feel like they're thinking through a fog. They know what they want to say, but the words don't come as quickly. They lose their train of thought during conversations. They find it harder to stay focused on simple tasks. These changes can develop so gradually that they're easy to overlook until someone else points them out. One of the most important things to understand about this group of medications is that they should never be stopped suddenly. After the body has adjusted to them, stopping all at once can lead to serious withdrawal symptoms and may even create significant health risks. If you have been taking a benzodiazepine for an extended period and you're concerned about its effects, the safest approach is to speak with your doctor. If a change is appropriate, your dose can usually be reduced slowly over time under medical supervision. That gradual approach is much safer than trying to stop on your own. Next, let's look at another medication that many older adults take for reasons that have nothing to do with depression, yet it can still affect memory. Number 4 is Amitriptyline. This medication may not be as familiar by name as some of the others on this list, but it's prescribed for a surprisingly wide range of conditions. Depending on the patient, it may be used for nerve pain, chronic headaches, insomnia, or depression. Because it has so many different uses, many people never stop to think that it could also affect memory. The reason comes back to something we've already discussed several times in this video. Amitriptyline has strong anticholinergic properties. In other words, it can reduce the activity of acetylcholine, one of the brain chemicals that plays an essential role in memory, learning, and clear thinking. For older adults, that effect can become more significant because the aging brain is already more sensitive to changes in this system. Researchers have found that long-term use of medications with strong anticholinergic effects may be associated with an increased risk of cognitive decline. The concern isn't usually what happens after a few days or even a few weeks. It's the gradual effect that can build over months or years, especially when the medication is taken regularly. One reason this can be difficult to recognize is that the changes often develop very slowly. A person may become a little more forgetful than they used to be. They may need extra time to remember names, misplace everyday items more often, or lose track of conversations from time to time. Because these changes happen little by little, they're easy to dismiss as nothing more than normal aging. In many cases, neither the patient nor the family thinks to consider whether a medication could be contributing. That doesn't mean amitriptyline is the wrong choice for everyone. For some patients, it provides meaningful relief and remains an appropriate treatment. The important point is that the decision should be reviewed from time to time, especially in older adults who have noticed changes in memory or thinking. Today, there are other treatment options that may have less impact on cognitive function for some people. If you're taking amitriptyline and have concerns about your memory, don't stop the medication on your own. Instead, talk with your doctor about whether another option might better fit your current needs. Now, let's move on to number 3, the medication I asked you to remember from the very beginning. Number 3 is paroxetine, and this is the medication I asked you to remember at the beginning of the video. The reason I wanted you to pay special attention is simple. Millions of people take this medication every year, yet very few realize it may deserve a closer look as they get older. Paroxetine is a commonly prescribed antidepressant. It belongs to a group of medications known as SSRIs, or selective serotonin reuptake inhibitors. Many people assume that because it's part of this newer class of antidepressants, all SSRIs affect the brain in essentially the same way. But that's not entirely true. Paroxetine has one important characteristic that makes it different from many other medications in the same group. In addition to its effects on serotonin, it also has relatively strong anticholinergic activity. As we've discussed throughout this video, medications with anticholinergic effects can interfere with acetylcholine, a brain chemical that plays a key role in memory, learning, and concentration. This becomes especially important in older adults. As the brain ages, it naturally becomes more sensitive to medications that affect these pathways. For some people, that may lead to changes that are easy to miss at first. They may notice it's harder to stay focused during conversations. They may need more time to remember names or organize their thoughts. These symptoms often develop gradually, making them easy to mistake for normal aging. Researchers have explored this connection, and several studies have examined whether paroxetine may be associated with changes in memory and cognitive function in older adults. While individual responses can vary, the evidence has been strong enough to encourage physicians to consider these potential effects when choosing an antidepressant for older patients. There's an interesting paradox here. A medication like paroxetine can be very effective at improving mood and helping people manage depression. At the same time, in some older adults, it may also contribute to reduced mental sharpness because of its anticholinergic properties. Both of those things can be true at the same time, which is why treatment decisions should always take the whole patient into account. This is also one reason many healthcare providers refer to the Beers criteria when prescribing medications for older adults. It's a widely used guide that helps identify medications that may require extra caution in this age group. Paroxetine appears on that list because of its anticholinergic effects and the potential impact on cognitive function. If you're taking paroxetine, don't assume it's the wrong medication for you. For many people, it remains an effective and appropriate treatment. But if you've noticed changes in memory or concentration, it's worth discussing those symptoms with your doctor. In some cases, another treatment option may be a better fit based on your individual situation. Now, let's move to number 2. A group of medications that many people don't even realize they're taking. Number 2 is a group of medications called antipsychotics. This one often surprises people because many patients don't even realize they're taking an antipsychotic medication. While these drugs were originally developed to treat serious psychiatric conditions, they are sometimes prescribed for other reasons, especially in older adults. Depending on the situation, they may be used to help manage severe agitation, behavioral symptoms, or other conditions when a physician believes the potential benefits outweigh the risks. In certain cases, these medications can play an important role in patient care, but they also require careful consideration, particularly in older individuals. Over the years, researchers have identified several concerns associated with the use of antipsychotic medications in older adults. Studies have reported an increased risk of cognitive decline, a greater chance of falls, and, in some groups of patients, a higher risk of stroke. These are serious concerns because they can affect both independence and overall quality of life. Part of the challenge is that these medications can make thinking and movement seem slower. Family members may notice that their loved one appears less engaged in conversations, reacts more slowly, or doesn't seem as mentally sharp as before. It's easy to assume these changes are simply part of aging or the progression of an existing illness, when in some cases, medication may also be contributing. That doesn't mean antipsychotic medications should never be used. For some patients, they are appropriate and may provide meaningful benefits that cannot be achieved in other ways. The decision always comes down to balancing the expected benefits against the possible risks for that individual patient. That's why these medications should be reviewed regularly, especially in older adults. If you or a family member has been prescribed an antipsychotic, don't be afraid to ask questions. Ask why the medication was recommended. Ask what benefit it's expected to provide. Ask how long it's likely to be needed, and whether it should be reviewed again in the future. Those conversations are an important part of good medical care. Every treatment plan should be individualized, and the goal is always to use the safest and most appropriate approach for each patient. Now we've reached the final medication on our list, and surprisingly, it's not a single drug at all. It's something that affects millions of older adults every day without them ever realizing it. Number one isn't a single medication. It's the combined effect of taking several medications at the same time. Many people expect the biggest risk to come from one specific prescription. In reality, the greatest concern is often the total burden created when multiple medications are used together. Each medication may seem harmless on its own, but when several of them affect the brain in similar ways, their effects can add up over time. This is especially important for older adults, who are more likely to take several prescription medications every day. Doctors refer to this as polypharmacy, meaning the regular use of multiple medications. Along with that comes something called the anticholinergic burden, which describes the combined effect of medications that reduce acetylcholine, the brain chemical we've talked about throughout this video. Think about how this might happen in real life. Someone may take an allergy medication at night. They also use a sleep aid because they have trouble falling asleep. They take a medication for an overactive bladder and another medication to treat depression. Each prescription was started for a reasonable medical purpose. Each one may have seemed appropriate at the time. Looking at any single medication by itself, the effect on memory might appear small. But when those medications are taken together every day, the overall burden on the brain can become much greater than most people realize. This is why medication reviews are so important. It's not always one prescription causing the problem. Sometimes it's the combination. Researchers have found that as the number of medications with anticholinergic effects increases, the risk of cognitive decline may also increase. That's one reason healthcare providers pay close attention not only to what medications a patient is taking, but also to how those medications may interact and affect the body as a whole. The goal isn't to make people afraid of medication. Many of these treatments are necessary and provide real benefit. The goal is to make sure every medication still has a clear purpose and that the overall treatment plan remains appropriate over time. If there's one message I hope you remember from this entire video, it's this: review your medication list regularly. At your next appointment, bring a complete list of everything you take, including prescription medications, over-the-counter products, allergy medicines, sleep aids, and supplements. Ask your doctor or pharmacist to review the list with you. Find out whether every medication is still necessary, whether there are safer alternatives, or whether some medications may no longer be needed. Sometimes, a small change can reduce the overall burden on the brain without sacrificing the benefits of treatment. Those decisions should always be made together with your healthcare provider, but simply having the conversation can make a meaningful difference. Protecting your memory isn't only about adding new treatments. Sometimes it's also about taking a careful look at the medications you already use every day. Before we finish, I want to leave you with one important thought. Hearing that certain medications may affect memory can be unsettling, but I don't want you to leave this video feeling frightened. I want you to leave feeling informed and empowered. The good news is that not every case of memory decline follows the same path. When medications are contributing to changes in memory or thinking, recognizing the problem early may create an opportunity to review your treatment plan. That's why paying attention to these warning signs and having the right conversation with your healthcare provider can be so valuable. The most important step you can take is actually very simple. At your next doctor's appointment, bring a complete list of every medication you take. Include your prescription medications, over-the-counter products, allergy medicines, sleep aids, vitamins, and supplements. Then ask your doctor or pharmacist to go through the list with you, one medication at a time. Ask whether each medication is still necessary. Ask whether the dose is still appropriate, and ask if there are safer alternatives that might be a better choice as you get older. Just as important, never stop a medication on your own because of something you heard in a video. Every treatment plan is different, and any changes should always be made together with the healthcare professional who knows your medical history. If today's discussion made you think about your own medications or reminded you of someone you care about, I'd love to hear from you. Have you ever noticed changes in your memory after starting a medication? Or do you have a question about something we discussed today? Leave a comment below. I read as many of them as I can, and your experience may help someone else who is facing the same concern. And before you go, I have another video that I think you'll find just as interesting. Most people pay attention to their heart, their blood pressure, or their cholesterol. Very few pay attention to their fingernails. But your nails can sometimes reveal early clues about underlying health problems long before other symptoms appear. In the next video, I'll show you 4 nail changes that are worth checking for, especially if you're over 60. It's something you can look at in just a few minutes, and it may help you know when it's time to speak with your doctor. Thank you for spending this time with me today. Take good care of yourself, stay informed, and I look forward to seeing you in the next video.